Thank you for stopping by the Inside Deschutes County podcast. We hope you click those subscribe and download buttons. Be sure to catch us wherever you listen to your podcasts. You can also find us on deschutes.org/podcast.
Deschutes County is an amazing place to live,
work, and play.
Great place to raise a family.
I love the weather and the high desert.
At Deschutes County, we provide excellent service.
Beautiful.
We're here to help you.
Deschutes County is the heart of Oregon.
Everyone wants to be here.
This is episode 10 of the Inside Deschutes County podcast. Thank you so much for joining us. I'm Eric Breon. This is a place where you can get caught up on everything that's going on in the county. Lots going on. We have two very special guests with us today from Deschutes County Health Services. Emily Horton is the program manager for emergency preparedness and COVID recovery. And Dr. Richard Fawcett is the health officer for Deschutes County. Thank you so much for stopping by and answering some important questions.
Thanks, Eric. Glad to be here.
Thanks for inviting me.
Well, we're headed into that season, right? It's
respiratory illness season.
season. Yeah, you probably know all too much about that, right? You got kids at home.
I do. They're getting kind of big, but already passing around some coughs, sniffles, sneezes, all those things back to school.
All that stuff.
Yeah.
All that stuff. Well, Health Services just put out some important information about this, right? I mean, what would you call it? Respiratory guidance? Is that kind of where you would go with that? I mean, it's kind of all encompassing, right? I mean, it's the COVID, RSV, the flu. So, Dr. Fawcett, I'm going to start with you. Can you kind of walk us through the concerns and why people should be paying attention to these things? Because a lot of times it just kind of, they hear it and it goes in one ear and out the other.
Sure.
But why should they be paying attention now?
Right. Well, especially with infectious diseases, I think a lot of things tend to be seasonal, and I think we're probably most familiar with influenza, or at least the flu season, we might call it that. I think we've maybe just spontaneously, I suppose, changed that to the respiratory viral season because we do see other viral infections be seasonal kind of during the fall, winter months, like RSV, for instance. And, I think we expect that probably COVID-19, some of the subvariants are going to be a little bit more common during the colder months. People will be inside, the chance for transmission might be higher. So, it's a little bit different during the winter months in terms of the circulation of these respiratory viruses. They're going to be more prevalent, and the risk, I think, will be higher in the winter months versus the summer. So that's why I think it's a good time to be thinking about how to prevent them now.
For people who aren't paying as much attention to COVID and the subvariants, what's the latest on that? There's one that's kind of making the rounds that I've heard of. What can you tell people in regards to that?
I think it's hard to keep up on, to be honest. I think maybe a starting point was, we had Omicron sort of disseminate around the world very quickly. So, last year, a lot of the infections we had here in Central Oregon were the Omicron variant, I think in the beginning of BA4, BA5. But since that time, it's changed a lot. There's a lot to keep up on, all the different names, et cetera. But I would just say that, our bivalent boosters that really did target some of the earlier subvariants of Omicron just are probably not as effective anymore because the ones that are circulating tend to be different. The new one's going to be against XBB 1.5, and there's other subvariants that are circulating as well that people talk about. But we don't always keep track of exactly which subvariant you're infected with, but just know it's going to be mainly Omicron.
So, Emily, there's a new vaccine or booster, right?
Yeah.
That's coming out or is out.
Yeah.
What's the latest on that as of this recording?
Yeah. So there is a newly approved vaccine for COVID. It's actually not considered a booster.
Oh, that's interesting.
Yeah. So it is a new, makeup and a new strain for these new XBB variants. So people are recommended to get that as soon as possible, but it's going to be kind of a new and different way of that being rolled out because instead of being provided by the government, kind of free from charge from everyone, it's changed to in the commercial market. So it's kind of switched up how people get it and how insurance has to reimburse, and it's kind of complicated a little bit of things, but people should have it available, in the next couple weeks locally.
So lots of changes then for health services then in regards to how you're helping people with this. Are you doing the same kind of clinics? Are you doing what's the effort there?
Yeah, so this year is going to be very different for us. Like I think last year in this September, October, November range, we had some 80 clinics and gave thousands and thousands of
80?
doses. Yeah. 80
clinics.
80.
That's a lot.
Yeah.
That's a lot.
This year, we just don't have the availability, and our focus has really shifted. So our messaging through OHA and our partners is to we are the safety net. So we are working with people that are at increased risk of getting it and having severe consequences, like in long-term care facilities, places where it's difficult to get, people that are uninsured. So really focusing on what's called the Bridge Access Program and how we can target people that wouldn't be able to get the vaccine other ways. And then helping people access vaccine through their providers, through pharmacies, if they're having trouble doing that, but they have insurance and other mechanisms of getting to the vaccine.
For both of you, how frustrating is it to manage all of this? Because it just seems like it changes every month. I mean, there's new guidance, there's a new variant, there's, the politics of it all, and how do you navigate that in terms of what it is that you're going to do for people? Because I would think that would be so tricky when you're sitting in meetings and you're trying to decide what the heck we're going to do based on all these outside forces. How do you navigate that?
So I would say, it is difficult. Some of it is not within our control, like how much vaccine we get from the state. Like that's something, we can put in a request for 10,000 doses and we're probably not going to get that much. So even if we wanted to go out and kind of have those mass type clinics like we had in previous years, we just don't have the resources from the vaccine side and the state. I would say the frustration for me is hearing, on the news and from the federal government and all these places, the vaccine is commercialized and you shouldn't have any trouble finding it or getting it. And knowing that doesn't always play out. And there's always going to be bumps in the road when we have these kind of shifts. Like this is a huge shift, right? It's like a blank check and all of this vaccine. And now we're moving to a different system. And there's going to be hiccups. There's going to be difficulties in insurance paying you back all, where to get it, how much to get. Providers are trying to navigate this all too. And everybody's doing the best that they can. But sometimes it takes patience from, our population to say, maybe I can't get it this week, but I think I can next week. But that's really frustrating because, you wish that you could jump in and you can see that these problems are coming down and people are wanting to do the best. Like they hear the messaging, get your vaccine, and they're like, yes, I want to get it. But then their access isn't as always as easy as we hope it would be.
We don't get to make the rules, I guess, in terms of how this plays out.
You don't?
Flows.
Come on.
And maybe that's a good thing. I don't know.
Yeah.
I'm here with Dr. Richard Fawcett and Emily Horton from Deschutes County Health Services. I want to ask this question. RSV seemed to come out of nowhere a little bit last year, at least in terms of me as a casual observer. How concerned are you about RSV and it kind of coming in and sweeping through or becoming as a big a concern, maybe not as COVID, but something that would have a fairly large impact on our community?
Well, I think it will be important. We did see a much higher incidence in RSV infections in adults last year, and a lot of adults have some immunity. A lot of us do from prior years or even farther back. I think, the idea that we sort of talk about is that there was just more circulating, I think, in general, and probably a lot of that was with, amongst the pediatric population, kids in schools, that sort of thing. And for such a long time, I think we were wearing masks and probably avoiding some transmission there of things like influenza, parainfluenza, RSV. So there just was more circulating, and not all of us, at least adults, did terrifically with that. Some people who have, more fragility in terms of maybe their immune system or other health conditions were probably more susceptible. So I think it's really going to be hard to predict what's going to happen this year, but I think there's a good chance it'll be fairly active.
And the flu, we can't even forget about that. I mean, that was
and that's always going to be something we're going to have to grapple with. It's unlikely that we'll have a very subtle or mild flu season. We might, but I think it's unlikely. I think the time that was probably the least of a concern was we all wore masks a couple of years ago. So, but aside from doing that, we're going to see some influenza for sure this season.
So what's the biggest threat then? Is the biggest threat one of these three things, or is it ambivalence? People just not, just kind of, they're so maybe tired, weary, wary of all these different things and not paying as much attention. What do you think is the biggest threat there?
Well, I think they're connected. I think, if we're ambivalent and, we just are tired of worrying about it, then we're going to have a higher chance of getting infected with one of these viruses. And so, we just want to really minimize the risk. I think that's what we think about a lot in public health, or even as a clinician, we think about that as well, preventative care. And, besides, I think just, having good manners and covering your cough and thinking twice about going into an extremely crowded place. I think vaccine is a good way to try to prevent some of these infections that we know we're going to see.
Yeah, I would just add, we have tools which, like the RSV vaccine, that's new. There's a new monoclonal antibody for RSV for young babies. We have treatments for COVID. We have COVID vaccine. We have the flu vaccine. We have lots of tools, and some of them are newer, right? So we have ways to combat these extreme outcomes, and hopefully people have an awareness of those things. I mean, I think it's a balance, right? Like we don't want people to be ambivalent, but we want them to make smart choices and minimize their risks in ways that make sense based on their risk factors. And I think that's something that we can all do. We can take into account and understand, ways we can help protect ourselves and our community too. So stay home when you're sick, do those kind of things. It really can make a big difference.
What is in May, it was the end of emergency declaration, right? And with that, I'm sure came some changes in regards to maybe funding, staffing. How do you navigate those things? Because it's still important, and maybe you've wrapped in RSV, and obviously the flu is still ongoing. How do you navigate those outside forces to still give the level of care or services to our community, even though those might fluctuate month to month, week to week, for all I know?
Yeah, I mean, I think public health is always kind of in a unique circumstance. We see ebbs and flows in our funding that can be difficult to kind of handle. I feel like we're lucky right now, and we have a pretty strong preparedness team and a team of people that are ready and willing to go. We have our new Medical Reserve Corps, which is a really exciting opportunity for our community, and a lot of the people that helped with vaccination on a volunteer basis are switching over, and we're able to use them in different ways within health services and emergency preparedness. So it's an exciting time in some ways. It's really hard, though, in other ways when you can see that kind of, it's the same as you say, people are exhausted by like wearing a mask or doing all of these preventative things that we ask for so long during COVID. That kind of bleeds over into funding and other kind of exhaustions that happen. So there's no easy answer, I guess I would say, but...
Oh, why not? Why can't there be easy answers?
Snap our fingers.
That's
all
right.
will be well.
That's right. Just like that.
Yeah.
I mean, you talked about the public being exhausted. I mean, the two of you must be exhausted as well, just navigating all these things. How do you deal with it on a personal level? This has been your career, in terms of navigating infectious disease and those kinds of things. And now since 2020, we've been dealing with, this big, massive threat. Are you tired, Dr. Fawcett?
Well, I'm older,
Are we all?
but I'm tired here and there, of course, but I think we also we get times of increased energy with motivation. I think we have really good team working, I think, at our health department. I also want to add that I think we have pretty good partnerships in this area with our clinics, our hospital, St. Charles, and all their hospitals in the area. And I think that helps a lot as well, that, we're going to see changes in recommendations. We're going to see changes in the subvariants that circulate. But I think at the same time, we're all kind of in this together. And I think when we're looking at, where can we get a rapid COVID-19 test, what pharmacies might be carrying the new updated COVID-19 vaccine, what pharmacies are carrying Paxlovid and therapies for COVID-19, what clinics need more information about what to look for RSV, how to test for that, or what have you, or what's the prevalence? Did you have a lot of influenza this week? We have that communication, I think, with a lot of our clinics in our hospital. Not always, but I think we do better probably with that than maybe a lot of other locations throughout the country. So that helps a lot, that we're all kind of in this together.
Yeah, talk a little bit about your relationships with people, because there's the medical front of it, there's also the information side of it, and then the kind of the treatment. I'm sure you're working with people like you mentioned St. Charles, obviously. I'm sure Mosaic is a big partner, and then you have the added, I guess, pressure, stress of people who might not have access to service or access to language or things like that. How do you navigate all those things, and how do they help you get that information out? I know that's a big question.
No, that's a kind of a confusing, long question, but I think I know where you're going with it.
I'm known for confusing, long questions.
Okay, got it. Well, me too.
I wrote it down here, so
Take notes.
So, yeah, I mean, that is we're kind of shifting focus from that large general population intervention kind of lens to being that safety net and really reaching those people, our houseless community, people that are underinsured, uninsured, connecting them with services. We're still really lucky with that question you had about funding. We have quite a few people on our team who are still able to do that really engagement and equity work. So, making sure that we understand not just to reach out to say we're doing it, but do people have the services they need and the ways to protect themselves and the information that they need to make informed choices. So we really are, working on language translation, working on, getting out there in the community and working with our partners that are out there even more than us doing the hard work. And kind of leveraging those relationships where we can to, reach people who are in those pockets that are, not going to watch the news, or they don't hear us on a podcast, or, they don't have a computer and they can't look up where those vaccine clinics are. So really trying to do that targeted work and try to really be that safety net for folks.
Well, it is a long and confusing question because it's a long and confusing way to address those things, because I would just imagine that they're so intertwined that you're trying to unravel all these different scenarios of things that you mentioned, the houseless community, language access, all, just insurance, all of those things, and it could probably be overwhelming. So if you didn't have the help from community partners or other health organizations in our community, I imagine that would be
impossible,
overwhelming, and can't do it, right?
Totally. And even within our own team, and we have discussions, how are we going to take the limited resources that we have and, kind of intertwine those with the resources in our community, and who really are those people? How do we find them and how do we reach them?
So what's the focus now? I mean, what should people be doing now? Because I imagine it's twofold. One, it's probably talk to your doctor, make sure that you have, all your information for your own personal well-being, but I imagine there's some responsibility that you would hope people would take about getting information as well. So what's the focus for maybe both of you in terms of your teams as to how do we get that out and what do we want people to really know and understand?
Yeah, I mean, I can't help but have my emergency preparedness hat on, right? So that's make a plan. Think about, ways you can protect yourself, assuming that you will get sick or be exposed, right? Like we're all probably going to be exposed to COVID, RSV, or the flu at some point, right? Like this winter, we know most people aren't staying home. You're going to go to the grocery store. You have kids in school. You go to church, you go to these different places and you're exposed in different ways. So kind of assuming that you probably will be exposed, how do you lower your risk and how do you look around yourself and kind of assess that risk in a way that makes sense based on your risk factors? And then make a plan in case you do get sick. What are you going to do with your kids? Do you have a plan for work? Do you have medications at home? Do you know how to access Paxlovid if it's COVID and, you're in risk factor or high risk group. Kind of think through those things in a way that, do you have chicken noodle soup in a can at home that you'll want to eat when you get sick so you don't have to get up and try to make it, like simple things you can do that really will make it easier. Assuming I probably will get sick this winter, how am I going to make this easier? Making sure I do get the vaccine that will lower my risk of having to go into the hospital and have some of those severe outcomes that, people still have. It's not like it doesn't happen.
And Dr. Fawcett, you would recommend people get this vaccine?
Yeah, I think so. I mean, we're always going to think of ways that people can access to lower their risk for getting, contagious infections. Or really for lowering your risk for any kind of injury or disease. So vaccines are very helpful. Not only is it important in terms of minimizing your risk for being hospitalized or even death or long-term effects of some of either pneumonia or some other complication from either COVID-19 or influenza, et cetera. But I think also in just limiting or vastly reducing the chance that you're going to transmit, these viruses to other people unintentionally, unknowingly, perhaps. It's just we want to reduce the transmission in our community. So, vaccine's a great way to do that. And we don't expect people to necessarily wear a mask or, not go to work because they're afraid of getting infected or not go to church or whatever, we want people to be with their families, to be at work, and to have a productive winter. But a great way to prevent this really is with a vaccine. It's not the only way, but it's really an excellent way.
Dr. Fawcett, Emily Horton, thank you so much for being here, answering some tough questions, but I think getting some good information out there as well.
Yeah, thanks, Eric. It was
Thanks,
great.
Eric.
We hope you enjoyed this episode. If you have questions about RSV, COVID, the vaccine, anything else, you can go to Deschutes.org/public health. Just lots of good information on that site. The Health Services social media pages are also a good place to get updated information. There's a Facebook page, there's an Instagram page. You can get up-to-date information there. And if you have a question about this podcast or ideas for future podcasts, you can email us at info@Deschutes.org. That's info@Deschutes.org. And remember to subscribe to the Inside Deschutes County podcast wherever you listen to your podcast. We'd really appreciate it. Drop us a review or a rating. We'd love to hear from you as well. Until next time, be safe out there.